I don't think there's anything out there that's going to be comparable in terms of the value of what you're going to gain.
The DIOnavi Full Arch Case-in-a-Box makes it very easy for you to do more full arch cases with more predictable outcomes and with a fixed overhead cost from a business perspective. We're super excited to be working with Patterson Dental as one of our trusted distributors for DIO and the DIOnavi system. With DIOnavi Full Arch, we also provide you a case-in-a-box for your treatment. The DIOnavi Full Arch Case-in-a-Box is amazing because it literally has everything that you need no matter what happens at the time of surgery. We also prepare for any scenario. If you decide not to primarily load the implants after surgery, the DIOnavi Full Arch Case-in-a-Box also includes a provisional denture so that you're ready for that scenario as well.
It seems to just take every little aspect of implant placement in mind.
So not only does it have everything you need for the surgery, the surgical plan, the step-by-step instructions, the surgical guide, the bone reduction guide if you asked for one, but it also has all of the pieces that you might need in a case.
I get one box that has everything in it. I've never seen a company put together such a complete package.
They turn a very complex case into a simplified procedure that you follow a specific protocol.
The DIOnavi Case-in-a-Box also provides you as a business with a fixed overhead per case. One of the fears with getting into full arch treatment is sometimes you don't really know what your lab bill is going to be. Depending on how that treatment goes and how the provisional and how the prosthetic restorations go, you can have a very wide range in cost on what that overhead on that case might be. With the DIOnavi Full Arch Case-in-a-Box, you have a set fee that includes everything you're going to need for that treatment. It's a true game changer, and it makes it possible to get into full arch treatment or to do more full arch treatment.
And I highly recommend DIOnavi for that reason. They have a process that simplifies it and makes the protocol easy and able to offer to our patients on day one.
All right, so let's take a first-hand look at a DIOnavi Full Arch Case-in-a-Box. When you receive the case-in-a-box, this is actually what you're receiving. You see it's a beautiful case for the full arch. It's a high-end treatment. We want to provide a high-end experience for everybody, from the patient as well as the clinical staff and everybody through the office. So with the DIOnavi Full Arch Case-in-a-Box, when we open the box, everything that we need for surgery is right here. So I'm going to go through and show you all the individual pieces. You actually receive a warranty card that goes along with the patient that they receive. It shows all of the information on the DIOnavi Full Arch process. We'll record the date the treatment was done, that it was done using the DIOnavi Full Arch, shades, design numbers, all of those things will be recorded here. So that's a patient treatment card that they can keep with them. We have the surgical guide and all of the surgical directions. So in this drilling protocol, we'll have all of the information for each implant site, what implant size we're going to use, all of the different pieces that are necessary. And as we go through, in this case, 6 implants for an all-on-6 treatment. You'll see all of the different implants that we're using, all the corresponding pieces, the actual diagram of the actual treatment itself. We'll see the radiographs, and we'll see this for each one of the implant locations. Bone density analysis of what we expect around the implant. This particular implant is going to have a sinus lift associated with it, but you'll see that for every one of those associated implants that we'll use for the guide. You'll also have your drilling protocol. So this would be our step-by-step drilling instructions, as we've talked about before, that walk me through the actual placement of the implants themselves. And again, we'll have a drilling protocol for each one of those implants. Information on the provisional that we're going to be putting in place, all of the documentation that we need to be able to know exactly how to do the surgery as well. So we'll put that here. And then here are all of your components. So in the case-in-a-box, as mentioned, the idea is you have everything aside from the surgical kits themselves here ready to go. So as part of that, we'll open up each piece. Now in this particular case, there's going to be a couple of different guides, and you're going to see why. In this case, we're actually doing a bone reduction, some immediate extractions, a bone reduction guide, and then the implant placement. So this is kind of an exciting case. So we have our initial guide that we're going to use to fixate prior to our extractions to make sure we get the bone reduction guide in the proper location. Post-extraction, we have our bone reduction guide, and then we would have the attachment on top of that to place our actual implants. And in this case, we also was requested with models, so we also have a printed model prior to the extractions and then a post-bone reduction. In this case, there actually is going to be a sinus lift, so we have the tubing and the nozzle required for the actual crestal sinus lift using the DIOnavi crestal approach. So you can see it's pretty exciting. All of the different pieces, you're getting these all from one location, literally in one box, without the need to go to multiple different sources. Can't make it any easier than that. So that's for our surgical process. And that's another piece, by the way, for the sinus lift, the nozzle that we're going to use for the crestal sinus lift that's associated with this particular case. Next thing we have is going to be our implant fixtures. Again, since this is all digitally planned, we know exactly which implant fixtures are going to be necessary, sizes, and everything else. In this case, we're doing an all-on-6 using our UV treated implants. So I noticed a sparkly case tells me this is a UV active implant, as we see here. So I have all of my implants, the associated healing screws in case we need those, and everything I need for my actual implant placements. So we then have all of the multi-unit abutments, and you'll see that we have all of the appropriate multi-unit abutments or angled abutments depending on the digital plan ready to be placed. And with the guided planning and the accuracy of the DIOnavi guide, it's amazing how parallel you'll find that these abutments end up emergence. The emergence is phenomenal. All set to the right proper depths and lengths and everything for the proper emergence. Next thing we have is our temporary cylinders. This is exciting because obviously we need the temporary cylinders to do the final pickup of the provisional. But the cylinders themselves are not only they included, but they're going to be pre-cut or pre-identified to be the appropriate length to match the provisional for this case. So again, it saves you, ideally, you don't even have to adjust the length of your cylinders. All of that's been done for you ahead of time. That leaves the last part of our case in a box, the actual provisionals. So you'll see that with each case, we have, first of all, in case you decide during surgery you don't want to do immediate temporization, maybe the implants weren't as stable as you hoped, we include a provisional temporary denture. So worst case scenario, you always have a provisional denture to fall back on. And here is your actual provisional. Our provisional denture that's going to go over the temporary cylinders. And as you can see, these holes, the emerging holes out of the provisional are quite small. But it's amazing with the accuracy of the DIOnavi guide, how that will just drop right over the top of the temporary cylinders and ready for you to do the final pickup. You'll also notice that even though this is the provisional, it has a full pallet in place. If this was a lower, there would be some flanges and some additional soft tissue flanges. That helps us get the proper occlusion. By using this pallet in place when we do the pickup, it allows us to get excellent occlusion right out of the gate, and it minimizes the number of adjustments that you have to do post-treatment. After we do the pickup, of course, we're going to trim out the pallet and we'll have just the restored teeth. So that's kind of the contents that you get in a DIOnavi Full Arch Case-in-a-Box. And it is literally exactly what it sounds like. Everything that you need for surgery, aside from the actual surgery kit, all in one spot, in one box. Beautiful setup, something that you can be proud to show your patients if they happen to see this during treatment, right down to the patient DIOnavi treatment card that they can keep with them. So hopefully that answers some questions on what the case in a box looks like for the DIOnavi Full Arch.
I can't recommend them highly enough. I don't think there's anything out there that's going to be comparable in terms of the value of what you're going to gain. If you were thinking about getting into Full Arch and you're looking for a workflow that is the best out there, DIO is it.